All right. Well, good afternoon. I'm Dr. Tom Britton, the President and CEO of Gateway Foundation. If you're not familiar with Gateway, we're a national not-for-profit. We serve over 8,000 people a day suffering some substance use disorders throughout the country. And I'm so thrilled to be here today to celebrate Hispanic Heritage Month. We have some incredible speakers today, 4 healthcare leaders and elected Representative Lisa Hernandez, who represents the 24th District. This is going to be an awesome conversation today. And, you know, I'm kind of the exception of, I think I'm the only gringo on the call. Tracy calls me the gringo, just so you know. And I have this incredible leadership team where out of 6 people, 1 is from Peru, 1 from Ecuador, 1 from Puerto Rico, 1 who grew up doing missionary work with his parents and lived in Spanish-speaking countries. And so I have this tremendous opportunity as a leader to get a very different cultural experience in my workplace than I think I typically would, was just such a rich benefit. And my wife, Laura, lived in Mexico and Central America, South America, and is fluent in Spanish and Portuguese. And so when I travel, I get a very different experience than the average American who looks like me. And so I'm just so excited to learn more and become a better leader as this conversation goes on. We're going to do some introductions in a minute, but where I wanted to start this is a series of webinars that we have done as an organization to really promote justice, equity, inclusion, and diversity. It's an opportunity for people to hear from people that are from different cultures to broaden their own understanding of that culture. And currently in the US, those who identify as Hispanic, as Latino, as Latinx are now the largest minority group, almost 1 in 5 people. An awareness that I have is that there's not really a race or ethnicity in this country that has one shared culture. Instead, there's significant diversity and differences among and between ethnic and racial groups. At the same time, there's shared experiences and overarching similarities that are unique to distinct racial and ethnic groups. As each of you know, the ethnic group that identifies as Hispanic, Latino, Latinx are not an exception, with significant diversity and meaningful differences from person to person and family to family. Some of the differences that are unique to the larger community are driven by one's own or familial country of origin, religion, citizenship status, their own generation, level of acculturation, including English fluency, and their duration of US residency. But regardless of differences, there's also very strong commonalities. As we talk today, I'd like for each of you to include reference to the differences and similarities as you see them relating to the question. So first, I'd like to have each of you do kind of the 10,000-foot introduction of who you are and your footprint. I'll start with my own, Dr. Teresa Karate.
Good afternoon, everyone. Thank you, Dr. Britton, and thank you for having this panel today. So I am the Senior Vice President. I am a Senior Vice President at Gateway Foundation and have been here for almost 4 years. But I have been a longtime leader in public health and education here in Illinois. And by way of introduction, I like how Tom phrased it. It's really not just my Hispanic identity, but where I come from. Those of you who know me know that I wear my culture on my sleeve and talk about the fact that I'm from Peru and very proud of that. So that has really influenced everything I've done in my career, as well as my education and my family. So it's a pleasure to be with all of you here today and to be among such great distinguished leaders in both healthcare and in the legislature.
Great, thank you, Tia. Esther.
Got to unmute myself here. Good afternoon, everyone. I'm Esther Corpus, and I'm the President and CEO of Alivio Medical Center. We are a federally qualified health center that was founded 33 years ago. To really address the healthcare needs of the undocumented Mexican population in Pilsen. Today, we have 7 health centers, and our patient population has changed. Our location in Pilsen serves the immigrant Chinese community, and so we're very proud of the work that we do. It's not just about accessing healthcare, but how we can improve the overall well-being of our communities. And this year, we also passed a bill through Healthy Illinois, which is our advocacy arm, because we feel that healthcare, everyone should have access to healthcare. And so Healthy Illinois, which is, as I mentioned, Alivio's advocacy arm, passed a bill that provides health care to individuals 55 and above. We were the first in the country to do this. And so, while we look at healthcare, we know that there are a lot of factors that affect how people thrive in their lives. And so we are at the table to improve the overall well-being of our patients. Thank you.
Thanks so much. Elio.
I wasn't expecting me next, so I had to unmute myself. Good morning, everyone. Thank you, Tom, Teresa. I will start by saying that I am honored to have been asked to be on the Gateway Foundation Board of Directors. And I believe I've been on here now going on 3 or 4 months. It's an organization that does incredible work in our communities. And I am so pleased to be able to contribute my grand of sand to the effort of the organization. I've been in healthcare for the last, 20, 25 years. I worked in hospitals. I've supported the C-suite, and all with the goal of supporting organizations and individuals who want to improve the health inequalities that exist in our communities. There's a lot of work that has been done. I was going to say Norwegian American Hospital, but Humboldt Park, and sorry, Jose, I forgot the new name, but Alivio and all the organizations that have been in our communities doing wonderful work over the decades. And for me, I've been honored to be a part of some of that work. In addition to that, I've also been in the media and television and reporting on a lot of issues that impact the community. I work in state government, but always staying focused on the needs of our Hispanic community. Always working towards the betterment of our folks, our people, and improving their well-being in our communities.
Thank you, Elio. Representative Hernandez.
Good afternoon, everybody. My name is Laura Hernandez. I represent the 83rd District in Aurora and North Aurora. And I'm very excited to be with all of you here because it's the topic overall, the Hispanic Heritage Month and healthcare is very important. My family was undocumented for 21 years. So not having healthcare for my parents was a very big struggle. Whenever they needed something as simple as a simple surgery, they couldn't afford it. They couldn't figure out how to get that. So I feel like there's a lot of Latino communities and Latino families that still need this help. And I'm glad to be able to talk about this with all of you. And of course, pass some legislation that can help our families as well.
Thank you so much. And forgive me, I realized I called you Lisa instead of Barb, which is a different Representative Hernandez. I promoted you to the federal level overnight. And Jose.
Thank you, Tom, and I thanks again for the opportunity to be with all of you. I want to thank Gateway and the rest, and you, Tom, for actually assembling this discussion. I think is the right discussions today. Just about me, I migrated from Little Island in Puerto Rico at the age of 15, and I went to New York City on my own. I'm proud of public schools in New York City, although I went to a private school in Puerto Rico when I was younger. I actually came to the city of Chicago 11 years ago, and actually the first person that I interacted in government was Teresa Garate. So, it has always been a very good relationship. Then later on, Esther and I actually met many times in Springfield, actually in advocacy and addressing issue of healthcare. So it's a pleasure. And Elio, I know you from many different settings, but and Barbara, I met you just recently at a baby shower. So, and but it's my pleasure to be here with all of you. Humboldt Park Health, which used to be called the Untitled American Hospital, has been in the community for over 125 years. I came at a time that there was no hope for the hospital to stay open. And I actually was in New York, and I got a call from a headhunter saying that they were looking for a leader to turn around a hospital that was failing. And they found me at the right age and at the right time of my career. And I made a decision, and I left. Many of my colleagues in New York City actually say that I was crazy, simply because, I had been CEO of 5 different hospitals in New York, and East Harlem, Central Harlem, and in the South Bronx of New York City. And it was no brainer for me when I walked into the Humboldt Park community and I saw the flags and the pride of the Puerto Rican community and all the ethnic, all the Latinos. I said to myself, I think I belong here. And I came in for 3 years. I've been here now for 11. My focus has always been improving the health profile of the community that I represent and who I am. So I went to some of the public clinics in New York City as a youngster, and I saw what was needed and required, and I became a very fervent advocate for healthcare for everyone, and actually going beyond just healthcare. I always say that in order for you to be a great leader in healthcare, you need to have 2 ingredients. One is to understand the politics of healthcare. And then the second one is to have the operational knowledge of this institution. So when you blend those 2, make you great. You will never be a great leader in healthcare if you don't have either one of those 2. So I'm going to kind of stop here, and I know that there will be more conversation. I will tell you a little bit more about some of the work that I have been doing in my career and on behalf of the Latino community, which is my passion for it.
Great. Well, thanks to each of you. It's so cool listening to each of your stories, because it really represents what I think I started with. There's a lot of significant differences, commonalities. So I want to blend kind of 2 questions for the next one. To really help the listeners understand a little bit more about the Hispanic Latino culture and how it interacts with you as people and in the work world, I'd like you to talk a little bit first about how your cultural background influences who you are as a professional leader, and then any barriers you may have experienced because of that and how you dealt with them in the workplace. And Esther, I think I'd like to start with you.
Of course, I was afraid you were going to call on me first. Well, I will just say that, I grew up in Pilsen. Okay. I'm from a Mexicano family, but both my parents were born in Texas. Growing up in Pilsen in the 60s is not what Pilsen is like today and what it was, even 20 years ago. It was a Polish Bohemian community. And, we were considered outsiders. And I went to a Catholic school in Pilsen, St. Pius. And the first thing that happened to me was that my first friend that I met, her name was Ixta Siwa. And as I was thinking about this, that's a hard name to say and to spell. And the first thing was that the teacher said, "You are now Sisi," because she couldn't say Ixta Siwa. And I feel like she stole her identity, and I just remember, I used to call her Ixta, that how she felt. And I kept calling her Ixta Siwa because I could say it and I could spell it. And my mother got a call from the principal saying I was a troublemaker for trying to convince them to just call her by her real name. And so I guess I continue to be a troublemaker in a good way.
In good company.
We're disruptors. So I think, what taught me early on was that we all have it within ourselves to stand up and do the right thing, whether it's, sticking up for your best friend who some teacher, just because she can't figure out how to say her name, decides she's going to change her name. That we all have that within ourselves, that strength and that purpose. And I also think, we have Hispanic Heritage Month every year, but I think, this is our time. I mean, we've seen the census numbers, right? We know that we have to stay together, united, because there are strength in numbers. And so I'm happy to been given that label of a troublemaker very early on in my life. And I think it's what you do with that, with that purpose. You have to be careful how you use that power and influence. But that has, I think, made me a stronger person. And I have, I was called a troublemaker at every hospital I worked at. I was an administrator for almost 40 years, but really trying to change the policies and the way that we treated our patients in those institutions was no different than how East Asiwa was treated, back in kindergarten. And so I just, those of us who are listening to this know that it's not necessarily a bad thing to have a voice and to push hard and to use your influence to make change.
That's a powerful story. Thank you very much for that. I think all of us are troublemakers on this call, but I'll turn to the one that I know is the biggest troublemaker on the call, and that's Teresa.
So that's a great story that you shared, Esther. I think when to reflect on that, how has my heritage either empowered me or have I had to overcome some discrimination? I was very fortunate, very young in my career, that I had really great mentors who saw something in me and pushed me to do everything I've done. And so I think, a message to people listening is, be a mentor. I believe that many of us, most of us are where we are because of mentors and the people that pushed us. So I think that that's really important. And also kind of, remember where you came from. So I was born in the United States. And when people ask me where I'm from, I don't say I'm from Chicago or I'm from Miami. I say I'm Peruvian. And I think, even though I was literally born here, but I lived there for so long as a child that it really shaped who I am. But it also taught me how fortunate those that live in this country are, right? When you live in a third world country and you come here and you look around and people are complaining about things that are not even important, you realize how fortunate we are and how much we in this country take for granted about the experience of life in other countries, like our countries of origin and our cultures. So I would say that, that has really shaped me and everything I've done, always in government or nonprofit, whether in education or public health, but also gives me kind of the strength to continue advocating for our communities, regardless of, obviously we're talking about Hispanic heritage, but there's so many underserved and marginalized people in the US, in Illinois, and everywhere we see. Gateway has centers in 16 different locations. So we see a lot of inequities. And so I think part of my goal as a leader for this organization is also to try to close those inequities and those gaps.
Teresa, and I think I'm having a little bandwidth issues. So if I suddenly disappear, Teresa, I want you to take over for me.
Sure.
So Elio, let me go to you, please, to answer that question.
Tom, I wanted to say that I'm one of those that came from a little island, the biggest island in the Caribbean. I was born in Cuba. I came here when I was 9 years ago, a long, long time ago. And I was very fortunate because I was able to come with my parents. And having your parents when you're 9 years old, it's a world of difference. It allows you to have mentors at home. It allows you to I like to say, we started on first base. We were fortunate enough to be able to start on first base. But one of the things that early on, and much like Esther, I went to a high school where my brother and I were the only Hispanics. And this was in the Cragen, Belmont area on the New York northwest side of the city. That has changed dramatically over the last 40 years. But at the time, we were very few Hispanics, and we faced a lot of the challenges that immigrants face. But from an early on,
Is Elio frozen?
I think he is frozen.
Okay.
We'll give him 1 second. And if Elio's not able to get back on, we'll switch to.
Oh, there we go.
There we go.
Good. So let me back up. I kept talking, but I'll say it again just in case it was just me. But I was fortunate to have my parents here, and they instilled in me and my brother a sense of responsibility towards our communities. My dad was a journalist for 40 years on radio stations in Chicago, on several radio stations. And he always had a sense of responsibility on the information that he shared with the radio listeners, with the community at large. And when I got my first job, which was in radio, I had that sense of responsibility as well. So I was very close to the culture. We maintained the language, which has allowed me to, I think it's been key in allowing me to move forward and be able to communicate. But it allowed us to, that sense of responsibility and the ability to communicate with our communities, to me, it was key. We've seen over the years how Chicago has changed. When I was, and I'm dating myself, 20 years ago when Univision opened their first television station here, most of the Hispanic community was in 4 areas, Pilsen Little Village, Humboldt Park, and Logan Square, or Wicker Park at the time. Now we're
South Chicago.
In South Chicago, right. And now we're 33% of the city and a large number in Cook County. So we've come a long way. And I think that we still have a long ways to go in many areas. While we have achieved the numbers in population, we have a long ways to go in getting voter participation to those same levels. We still face a lot of healthcare inequalities in our communities, and we haven't achieved the economic power that is really going to make us that force that's going to effect change at a much larger level. So to me, it's a sense of responsibility that we all have to make all those efforts a reality. It's a grain of sand that we're going to contribute. Some of us have more grains of sand than others, but it goes into the big bucket. That big bucket being our community, our culture, and propagating that throughout the state of Illinois and beyond.
Thank you very much, Elio. Representative Hernandez.
Thank you for the question, and thank you everybody for sharing your stories. I think they're really important, and it makes me reflect on my story a lot. I think I was very lucky early on to go to a school district, East Aurora school district, that had a lot of Latinos in their community. However, I can see that later on, after when I went to college, it switched. It was a culture change that I had to go through because I was used to seeing a lot of Latinos in my high school and my school, and then going to college, I was the only only Latino in college, or at least in my class, or maybe I was only like 2 or 3 of them. So it was a different perspective. And to see that all of a sudden, that I was so used to seeing a community that looked like me and teachers that looked like me, to nothing at all. And to remind everybody, it was still in the same community. It was still in Aurora. So I went to Wabansi Community College, I went to Aurora University, and to see that culture change all of a sudden, it was very different. That taught me a lot growing up, of course, because I knew that I had to get different perspectives, different ideas, and also the way I presented myself was different. I was used to telling people, or not even telling people, that I was Mexican. But then whenever I said, oh, I'm from Aurora, I'm like, no, where are you from? And I was confused. I'm like, I just told you I was from Aurora. Like, well, where are your parents from? Oh, they're from Mexico City. I'm like, so you're Mexican? And I was like, oh, I guess that's what you see now. And then when I go to Mexico, it's totally different. I'm like, oh, I'm Mexican. And they're like, no, where are you from? I'm like, I'm from Aurora, Illinois. And it's a culture shock completely. And it's something I struggled personally. And I still kind of struggle at times because you never know how to present yourself. And now I'm proud to say I'm Mexican American, and that's who I am. And I hope that others are also outspoken about it and accept our culture and celebrate Dia de los Muertos and our independence and everything else that we have. And it's great to share with individuals. But that definitely formed me to where I am now, because now I know that there's a lot of disparities, not only in healthcare for the Latino community, but there's a lot of in education and services overall that families can't receive because maybe a language barrier or because they don't know. So I feel like it's my job to be able to provide that to families, to give them the opportunities available to us, to them as well. It's something that I hope to continue to do, but it's just the beginning. There's a lot of things that we need to all fix, we need to all target, and I know it's going to take a few years, but I know it's going towards the right path. Just 2 years ago, we were able to pass what we call the Latino Caucus, the Abuelito bill, where undocumented immigrants are able to get Medicaid after 65 and over. And just this year, we were able to extend it to 55 and over. So it's little changes like that that are going to make a wonders for the Latino community.
And Representative Hernandez, I want you to know that was an alivio bill from Healthy Illinois. We took to Delia Ramirez. So this effort, starts from the community, but we need those partners. We need our elected officials to help us get those important pieces of legislation passed. So I applaud you for standing with us to get this done. It was very meaningful. Our patients are all, 75% of Alivio's patients are undocumented, which for those of you who are in healthcare understand that these are patients that are completely unfunded. And we still offer comprehensive healthcare to them. And so anyway, I appreciate your work and the Latino Caucus and working with us on that bill.
Thank you both. Jose.
Thank you, Tom. And, listening to each of the panelists, although we all consider it to be Latinos in our own world, we kind of all come from different backgrounds and also from different experiences. I mean, I think it's only Elio and I are individuals who came to the U.S. from another part of the world. So I came from Puerto Rico, he came from Cuba, and the other panelists were born and raised in the United States. So I usually look at Latinos in this country through my own lens, my experiences as an individual who came from a small island and actually trying to blend or adapt to a new environment where I kind of left behind my families, my friends, and the culture that really embraced me to be as a person that I always carry that. So when we talked about not forgetting where you came from, the experiences here in the U.S. For me has never allow me to forget what I came from. And I will say to you that, for example, going to New York City at the age of 15 and trying to adapt and going to school there. I went to a public school that actually had many Puerto Ricans, Dominicans, which were the majority of the Latinos there. There were no other ethnic group there. And then after that, graduating and actually going to City College, that actually was a public school where there were many African Americans and Latinos from different part of the country, but part of the world, but the majority were Dominicans and Puerto Ricans. But then, I went to graduate school, and then it was a different story, because when I got there, actually everyone was Anglo and Jewish and rich, and I was poor. And I remember going to my first visit, the university, and I was dating a nice-looking young lady, and always dated a nice-looking young lady. So I remembered leaving the school and taking 5 cents and put it in a phone and calling her and say, I came to this university. It's beautiful. It's nice, but I don't think I'm going to make it here because I don't think anybody is like me. So I look at the lens of people who migrated here through my own lens of my experiences of the cultural shock, adapting to a new environment, trying to be accepted in a society that is different than you, and that you speak different, and that you look different, is a challenge that there are some commonality among all of us, but also my experience was somewhat different than many of you. And it is a struggle that actually never ends. And even at the professional level, you are never accepted within a certain level of, for example, at least in healthcare. I could cite you a couple of examples. For example, I give you examples. When I arrived here, I remembered I came to be the head of this hospital, and actually the head of the president of the Illinois Hospital Association was someone that was in New York City who I knew from. And I remember calling her and saying, you don't have any Latinos on the board of the Illinois Hospital Association. You don't even have any Blacks. It was all, and that was 10 years ago. And shortly after that, I got a call. They wanted me to join the board of directors. And I did. And I have been there since they invited me to be a board member. But here's the catch. So you could be on the board, but if you look at the structure of the Illinois Hospital Association, the executive committee of the board actually elect who's going to be the next president of the board. So for many years, I've been sitting on this board, and I never ascended to the executive committee of the board until I raised the question. I called the president. I said, I've been on the board now for quite some time, and I've seen many Anglos who actually join the board and suddenly they ascend to be on the executive committee, and they become chair of the board. And I had to raise the question for them to recognize me and giving me an opportunity to be on the executive committee of the board. And these kind of experiences for me, and I am a successful healthcare professional with many years of experience coming from New York City and actually running 5 different hospitals. And here I am still trying to be a struggle for being inclusive, for recognitions, to value who I am. And that kind of reinforces every day for me my commitment to advocacy, to be a mentor to others, to give opportunities to other individuals that I sound like me, they look like me, and it will never stop. And I'm glad to see leaders like in this panel with their love and commitment to create those great opportunities for others, which I could have been one of those that you actually will be saying, I'm going to commit myself to help you with this. You know, the power of mentoring. I would have never finished graduate school unless I found a Puerto Rican professor at Delphi University in New York that actually embraced me and believed on someone like me who was committed to obtaining education and who wanted to move on. Would have never happened without his help. And that is the experience that we wanted to embrace and bring together. And let's don't forget where we come from, folks. It is actually the most powerful things that we have is not forgetting where we came from and what we went through, and how can we use that as a positive experience to actually lend and support others who are less fortunate today.
Wow. You know, it's interesting listening to what's been shared by the panel so far is making me reflect, you know, some on my cultural experience as an Anglo in this community. And, you know, I was born in 1970 in Connecticut and lived in a suburb outside of Hartford. And I remember it was 78 or 9 that there was a busing initiative where they took children from inner city Hartford out to this suburb. And it was the first time I'd been in school with children that were a different color than me. And that's not that long ago in the scheme of things. And, you know, Chicago is one of the most segregated international populations in the country, you know, that I think something that happens in our culture is people who are similar come together. And those who are not similar need to work to come together, you know, that it takes an effort to step outside. And, you know, my mom started teaching me at a younger age what white privilege is before it was an expression, you know. And as I think about who I am today, like I'm 50 years old and I'm running the largest nonprofit in the country, I don't think that I would be sitting here were I not a white, educated man from a family that looked like my family. And so as I think about like, what does that mean my responsibility is, you know, and it's amazing because I have this tremendous privilege of influence in this job where I can help make something like this happen. And I think perhaps this is a call to action is that, you know, each of those on this panel have tremendous privilege because of where they are professionally. But everyone who's listening to this, just by nature, if you have found this panel, that you have privilege. And I think part of our work is to come together with people that are different than us so that we learn more about the larger world. And I'm grateful to each of you so far. So let me use that a little bit as a springboard for another question. As you think about the larger work world, and employers and decision makers kind of making policy and creating opportunity, what do you think leaders can do all the way down, frankly, and, you know, in my organization, part of how I think about it, there's servant leadership, which is like flipped. I think about it as the wheel of leadership, that everybody is kind of together in a circle, and that we all influence leadership. But as you think about the leaders out there, how can they create better opportunity, better inclusiveness, better diversity in their own work worlds? And I think I'll start with you this first, Elio, on this one, please.
I'm glad you mentioned that, Tom. And one of the challenges that I think we all face, Jose touched on it, his experience with the Illinois Hospital Association can be, or rather it's mirrored throughout corporate America. We see a lot of lack of diversity at senior level at the senior level in many organizations, at the board level, very few minority participation. And one of the things that I think leaders need to do, well, let me back up. One of the many excuses that you hear is that, well, there isn't a pool to pull leaders from so that we can fill these positions. I think Dede is an exception. She was one of a few in state government that was able to transition into leadership roles in the non-for-profit world, but there are very few like her. And one of the things that I think leaders can do, and not just Hispanic leaders, these are leaders such as yourself, and that is to open the door, to allow for the inclusion of minorities at the manager, director, senior leadership positions, to prepare them and to set them up for the next level, so that when a position opens up, and hopefully not in the next 15 years, say in the Gateway Foundation, there's a pool of individuals that can be have a conversation with. So there's a pool. So I think that continuing to put the pressure, continuing to raise questions, to continuing to enlist elected officials, I think they play a pivotal role in being able to open the doors so that organizations can come in and say, why is there no more, why is not enough inclusion initiatives in your organizations? And continue to put that pressure so that we set the stage by opening doors, and then in the future allowing those individuals to move up into senior leadership roles.
All right, thank you, Elia.
Can I just jump in?
Hernandez, what about your
go
thoughts
ahead.
on that?
Well, I think there's a lot of great mentors out there. However, I think amongst ourselves, at least what I've seen here in Aurora, amongst ourselves, we disagree to a certain level. We're not ready to mentor the upcoming youth, and it's frustrating a lot. When I was one of the struggles that I had when I started politics, I began when I was 14, getting involved in the community. And then actually running for office when I was 20, I was told by one person, by an older Latino person.
Frozen.
Uh-oh. Esther, you want to jump in?
I think did you guys lose me a little bit?
Yes, you're back.
Okay, sorry. So like I was saying, I think growing up, there was a lot of mentors available. However, their intention was debatable. I wasn't sure if they were really trying to mentor me because they cared about my future, they cared about me growing up, or if they were just mentoring me to stay close to me and in a way have an input of whatever I did in the future. So it was complicated at times because when I ran for office when I was 20 for a small community position here in Aurora, I was told by a Latino older gentleman that why am I running? That I was going to lose, that there was no point of me running. So I felt very discouraged and upset because a Latino that also had children of his own around the same age as me, he was just telling me, don't do it. You're going to lose. You're too young. You're too young to run for office. I felt very, very upset to see that my own community was trying to just push me away from that instead of helping me. So I think we need more mentors that are not going to be, and I'm going to use this word because it's been happening a lot in my career, jealousy. That jealousy of youth getting on top of certain things can be pushed away, and focus that we need to push the young generation to be where we are now, because eventually we will need someone to replace us, to take charge of what we started. And if we don't, then we're going to be saying the same thing we're saying now, that maybe that we don't have enough people in our community to replace us, to pick from for boards, for positions, for elected officials. We need to start now. And I think that's the main thing. We need to make sure as mentors, we are putting our personal opinions and thoughts and our jealousy aside and be able to help the community.
Thank you, Representative. Esther.
Yeah, no, I kind of wanted to piggyback on what Elio said about, in particular, and what, Jose experienced with the Illinois Hospital Association. And I was really excited when Jose came to Chicago, because having been a hospital administrator myself, I saw that lack of diversity, at all levels in hospital operations. And but I think, looking at the board is so key. We all operate in with businesses and with organizations and foundations and other other organizations, and you see that lack of diversity. You don't see people that that look like the consumers that they represent, in particular. That's really disturbing. And it's not just race, but it's also, age and other factors that make us, better. I can say, at Alivio, I struggled with that because our board was mostly Latino, but we serve other populations too. And so we had to get a little bit better at looking at our own diversity, because and it's not just Mexicanos. Right now we have Dr. Garate, who's Peruvian, and Jose and Elio. I didn't know you were a Cubano, but I mean, we need to look like the people that we serve. And one thing I will say is that I think that what has changed over the years, because I don't want to date myself either, Elio, but I'm older than you apparently, that I think things have gotten better. Are we there yet? No. But I think that there isn't a better time than now that we can really make some significant change, where people are finally, looking at, we're makers, we're not takers, right? The Latino community has built this country, and we have seen it, especially during this pandemic. 70% of the essential workers were Latinos. We would have collapsed if we did not have the workforce to keep our grocery stores open, to be, keeping our hospitals and health centers and grocers and, all the hospitality industry. So I think, we need to continue to work together, to be united, even though we all come from different backgrounds. We have to be united, because in that unity, there is strength, and in strength, there is power. And we all have it within ourselves. And there, I mean, we went through a horrible time. Let's not forget our previous president. And he's threatening to run again. Okay. We cannot let this happen. We have to be strong together in order to make sure that we continue to make the progress that we've made. So I'm, getting a little on my soapbox here, but I think it's really important for us to understand where we're at today as well, and look to the future so that we can provide a better opportunity for the future for the younger ones that are coming. Yes, we all are going to get replaced, right? And we want that. We want to have, the Representative Hernandez, who's young and, has the whole future ahead of her. We have to create those pathways. And I don't think there's not a person on this call right now that hasn't had a mentor, somebody that gave them, la mano, that ayuda. And we have to, put whatever, the jealousy I have not experienced. Maybe I did and didn't realize it. That makes me sick to my stomach that people are jealous because you've done something good. We gotta get past that. There's a lot at stake.
Thank you, Esther. Teresa.
So, I think your question was, what can employers do? I think I'm proud that for Gateway, I get to lead our JEDI initiative, and we've taken baby steps to really create a culture of justice, equity, diversity, and inclusion. But I really believe that if you really want to achieve that, it can't just be a program. It can't just be an activity. It has to be an entire culture change, and that takes time. And so, again, I think about our ethnicity, our race, our culture, our disability status, our sexual identity, our gender identity, all these things that go into diversity are complex. And I think making sure that employers know that every employee is a different human being with a very unique experience, right? And so, as Jose mentioned, right, I am Hispanic, but we come from very different worlds and very different experiences. So making sure that employers understand the unique nature of everyone's identity and how that influences how they work. I also think that we need to do a better job of not just saying, hey, let's promote Hispanics, or let's identify diamonds in the rough for people who have that strength. We also have to do a better job of helping people to better themselves. And Gateway has done actually pretty aggressively promoting professional development. So if we want you to be ready, we also have to do our part to get you ready to be that manager, to make sure that you have the skills and the comfort level to put your name in the ring for a position or a job. I think Representative Hernandez, you talked about people who were insecure, really. And so saw you rise and be successful. And maybe that was a reflection on themselves saying, wow, she's so young, she's done all this. How come I haven't done it? Well, too bad, so sad, right? Like, that's, you haven't done it, but we all have to kind of rise above that and realize that not everyone can do. If you think you can do it all and solve it all, then obviously that's a sign of a really bad leader, right? All good leaders know where their strengths are and where their gaps are, and how to fill those gaps, and how to surround yourself with people that are better than you, smarter than you, so that together, as Tom says, it's kind of a circle of leadership. But I think for the topic of our discussion today, identifying Hispanics who or Latinos, or whatever group you want to talk about, who really have the potential, but also those who maybe they don't think they have the potential. But you can do, as an employer, you can do something to help them get there, so that they will be able to rise and emerge as a strong leader.
Thank you, Teresa. And Jose.
I mean, I don't know correctly how to angle the question, because there are so many things that really comes to my mind. I'm going to try to organize myself in a way that basically will help you understand how I see it. I mean, there is no question that we need to do more in terms of creating leadership and boards and organizations and that are people like all of us. But I also believe that all of this would only happen if each one of us will continue to take as a priority our social responsibility to the individuals that we really represent. And don't know what that is, but it's my phone, and excuse me.
It's an Amber Alert. All our phones are going off right now.
Yeah, so I'm sorry about that. And social responsibility, but also how can we as leaders continue to partner with others, with government officials, we elected representatives to continue to partner to create and raise the bar in terms of expectations. I mean, I think that we are and one of you mentioned that we are at the right time in this country to begin to make changes. I think that the Black Lives Matter movement have actually propelled other insights of all of us to say, where do we go from here? Because that's an African American agenda, but I think we could take advantage of that to partnering to begin to join forces as Latinos, as being the majority in this country or minorities right now, to be able to leverage some of those relationships with these other ethnic groups to be exactly where we want it to be. I also believe that we, this group here, and others who are not on this panel, who are in position of influence, will have to take a very strong role to begin to make, to influence others, organizations, and the corporate America for them to really exist. Esther, you talked about that without the workforce that we have here, this country would have collapsed. I will take it a little further. The economic power of the Latino today in this country is huge, okay? And it's an economy that continues to thrive and grow. And I think we need to continue to leverage that across the nation. We are beginning to talk about inequality, equity, health disparity. I think that this movement today, having all of us engage in that conversation, and we're beginning to say, I give you an example. I have someone that I love dearly, which is the president and CEO for De Loreto Hospital, George Miller, African American man, very eloquent, who we have become very good friends. So, George and I has become very good friends. And he says to me all the time, when I came to Chicago to be the head of De Loreto Hospital, no other CEO of hospital pick up the phone and call me and congratulate me except you. He sent me a message. He's telling me I am not welcome here. I am not considered like everybody else, even though I'm a CEO of a hospital. And he said that. And in the middle of this movement of Black Lives Matters, he called me one day and he says, I think that we need to really focus on pushing and the Illinois Hospital Association to take a look at health equity here. And he says, why don't you and I write a letter to the president of the IHA? And we wrote him a letter expressing our concern with health equity in our state and in the country. As a result of that, the Health Equity Committee of the board was born. So he both of us, he and I actually share that committee. And I'm at a time in my career that I speak very freely and I say what I feel and I think. But when we were putting together the website Equity Collaborative, okay, it was actually called by Sinai. And although they are a safety net hospital as well, but it was driven by a group of individuals that didn't look like any of us who are in this panel. And they invited me to be part of it. And my requirement was, I will come to the table if I play a leadership role. Well, then I became the co-chair of that group with my dear Dana Thompson and myself are actually the two co-chair of this group. But it's using who we are to actually capture and get the things that we really need, and always ask and demand for the things that we want. So as we try to influence corporate Americans and other institutions to include many of us, is that they play a role in what they do. I give you an example. I look at the board of Northwestern Hospital, and there are a couple of Latinos who sits on that board. But are they the chairman of the board? Are the vice chair of the board? No. So we get invited to these things to be just filling a gap. We need to begin to demand roles. What powers and influence are we going to have on these things? Because it's not only to have a Latino or minority on a particular board. Yeah, they have been getting away with this for many years now. The question is, what are their power and their influence at the head of a committee? How many of them, a Latino, is the head of the finance committee or the quality committee, right? So we need to really think about strategies to ensure that we don't continue to be in that circle. Let me fill the gap with a talking Hispanic, okay, to just say, I fulfill my role. So we need to continue to have many conversations like this one, because we have a responsibility with a generation behind us, that we are going to be the person that create that pathway for them to get where we want them to be. You know, we all struggle to be where we are, but now we have a social responsibility to those who are behind us, that pathway to move them forward. So with that, I'm going to pause here. I don't know which direction I went with this, but I was just speaking my mind about the way I see it, because I'm probably the oldest of the whole group in here. So
You're the oldest troublemaker, Jose.
I have a different perspective than many of you. But hey, you know, I'm glad to be in this panel and having this kind of conversation as we kind of craft a new agenda for Latinos in this country moving into the future.
Well, I want to thank each of you so much. And I want to thank those that listened, because if you listen today, it means that you're interested, you know, and that this is something important to you for whatever reason it is. We're out of time today. I wish we'd been able to do more, but it has been just such a fantastic panel. I want to thank each of you and have you know that even though I'm not Hispanic or Latino, that I'm part of the fight as well. And I make my personal commitment to use my influence to really kind of include and make a better world for Hispanics, Latinos, Blacks, anybody that is different than me. So thanks to each of you. I hope you all have a wonderful day.
Thank you.
Bye.
Thank you, everyone. And thank you, Tom. You are an honorary Latino for hosting.
You kind of look Latino, Tom. I mean,
I do. I fit well. When we travel, people don't know unless I talk. Then I'm in trouble. All right.
We'll teach you Spanish soon.
That's it.
thank you.
Thank
Bye.
you.